Hello, I'm Dr. John Perlin, Chief Medical Officer at HCA Healthcare. As we prepare for a surge of patients into our hospitals from the COVID-19 pandemic, HCA Healthcare is taking a science-based approach recommended by the CDC to equip every patient care team to provide safe, effective, compassionate care while maintaining an adequate supply of masks. One thing that we know about COVID-19 is that the virus is spread by droplets. The virus doesn't appear to float in the air like pollen. It attaches itself to fluids like mucus. So preventing the spread of COVID-19 means stopping the spread of droplets by washing hands, cleaning surfaces, and protecting faces.
That's where masks come in. Masks are used as a barrier against droplets, not as a filter for air. And that's good news, because it's a lot easier to clean and disinfect a barrier than it is to change an air filter. It means masks can be used longer to keep our caregivers safer. I'm Jane Engelbright, the Chief Nurse Executive for HCA Healthcare. We want to make sure that every clinician and every caregiver has the right mask at the right time. That's why we stock 3 different types of masks, and they are used in different situations. We've all become familiar with the acronym of PPE for personal protective equipment, but this acronym can also be used to describe the appropriate situations for various levels of mask. We use masks for precaution when working with caregivers and patients, for protection from possible cases of COVID-19, and for cases where exposure to COVID-19 droplets is highly likely.
As the COVID-19 public health crisis continues to escalate rapidly and the public spread of disease becomes more pervasive, HCA healthcare facilities are adapting masking guidelines to continue to care for patients and the community while ensuring the continued protection of all patients and employees. Beginning March 31st, we implemented universal masking for all staff and providers in patient care areas. Masks will be available, but optional for staff in other areas that can consistently maintain social distancing of at least 6 feet. Our ability to socially distance when providing patient care and within the workspace is limited. So we are implementing these guidelines to protect both our patients and our staff.
Level 1 masks are used for precaution. These are used by staff who are not directly caring for COVID or suspected COVID patients. They can also be used by staff who have been previously exposed to COVID but are not having any symptoms. They're used by screeners and anyone else who is in the care environment. When paired with a full face shield, Level 1 masks can be used when caring for COVID positive or suspected COVID patients. Level 3 masks are used for protection. These masks provide protection from fluids and droplets. They should be used by staff who are directly caring for COVID positive or COVID suspected patients. They must be paired with appropriate eye protection, such as goggles or a face shield. The N95 mask can be used for protection and for situations in which exposure is likely. Staff caring directly for suspected COVID or COVID positive patients should be using an N95 or the Level 3 based on availability. During an aerosolizing procedure, an N95 mask must be used by all staff in the room. Aerosolizing procedures include intubation, nebulizer treatments, bronchoscopy, BiPAP, CPAP, vapotherm, sputum induction, and open airway suctioning. N95 masks must be paired with eye protection, either goggles or a face shield.
We are optimistic that having a universal masking policy and practicing effective social distancing will mean that we can continue to protect our workforce from viral spread so that they in turn can continue to perform critical services for patients in need as they serve the community. We also believe that universal masking will not only provide a safer environment for all, but also help to preserve our personal protective equipment across the enterprise. I know I stand with the entire leadership team in gratitude to every clinician and caregiver for their commitment to our mission, the care and improvement of human life. Please know that all of us in the leadership team and across HCA stand behind each and every one of our caregivers and clinicians as they serve the patients and the communities that are the focus of our mission. Thank you for what you do each and every day.